Pain relief has moved quite a lot. I mean, we need to see where the pain is coming from. Some women may have a large, huge tumor in the breast, or may have lymph nodes under the arm or in the neck, which is not operable. So that's a different type of pain. Another woman may have 3 or 4 fractures in the back where you've had radiation to. Cancer is controlled, but because the bone is broken, so every time you move or walk, it hurts. So these two are different kind of pains. Then third is a woman who has a pain in the shoulder, and you found a deposit, you've asked her to, then you've done the radiation, put a nail there, and she is pain free. In general, all strong painkillers will cause you to have 3 side effects. They'll make you nauseated, they'll make you constipated, they'll make you sleepy or foggy head. Body will usually get used to sleepiness and confusion. Body will usually not get used to constipation, and therefore if you are on strong painkillers, you need to be on some sort of medications to make sure you're not terribly constipated. Different patients handle different tablets differently. Like some of you, if you've had pain, may have been given Endone. I've given Endone half a tablet to some patients because they can't handle a full one, and they say it makes them spin and they can't remember who they are. And there are other tablets who are on 30 or 40 milligram of OxyContin, which is long acting Endone, and they say they are fine. I think the painkiller has to be titrated, and it can change depending on how well your patients are, how their liver and kidney functions are, and what type of pain you have got. Some patients may have deposits in the spine, they've got pain running down the nerves. So just simple painkillers may not be sufficient. They may need neuropathic drugs like Lyrica and stuff. And if any patient has complex pain requirements, I often would ask our palliative care colleagues to help us with the pain. But by far, pain is not a huge feature for most patients. It can be very well managed in this day and age. There are a lot of pain relief options. I always suggest to patients to just keep an open mind. Just because the first painkiller didn't work well with you doesn't mean the others won't work. And in most patients with advanced breast cancer, pain may not be an issue even when they are dying.